Feeling bloated often, like your stomach is tight or full, you're not alone. See, bloating is one of the most common complaints with which patients comes to us. But the reasons may surprise you. So, what are the common causes which can cause bloating? One of the common reasons is air swallowing, which we normally call aerophagia. This can happen when you eat fast, you talk a lot while eating, or if you are a mouth breather. These days, I see a lot of patients with mouth breathing, which can happen either because of excess stress, multitasking, anxiety. So, all this can cause you, make you breathe orally, and which all this can make you swallow excess air, resulting in bloating. In addition, excess fiber intake can also cause bloating. See, fiber is healthy, but too much fiber can ferment in the gut, producing excess cause and resulting in bloating and gas production. In addition, stress and anxiety also need to be looked into because gut and brain are interconnected. Any stress can worsen bloating and digestion. Some people feel gassy and bloated even when the gas levels are normal in their intestines. This we call as visceral hypersensitivity. This normally happens when the people are very reactive, sensitive, and very delicate to the pain. So this we call as visceral hypersensitivity. Now comes to what we can do to prevent bloating. Avoid overeating, especially fatty foods. Avoid late night heavy meals. If you're lactose intolerant, that's milk intolerant, how to identify whether you are milk intolerant? Especially some people, when they consume milk, notice excess sounds in their tummy. In addition, along with that, they might feel bloating and loose motions. So if you have these symptoms of the consumption of the milk, you might be lactose intolerant and you need to avoid taking milk. In addition, other measure which you can take is you should eat slowly and mindfully, and make sure that you don't talk a lot or watch screens while you're eating. Regular exercise also can improve bowel movement, thereby reduce your bloating. Reduce high FODMAP diets if the symptoms are frequent. I gave a video description on FODMAP diets, which are the foods to be avoided, which are the foods to be consumed in my previous videos. You can have a look at that video. So other thing which you can do is, if you're a smoker, you need to avoid smoking because smoking can worsen bloating. In addition, stress and anxiety has to be managed. And finally, when you should see a doctor? You should consult a doctor if your bloating is getting progressively worsened, if it lasts more than a week, or this bloating is persistently associated with the pain. In the end, bloating is common, but with the right habits, your gut can feel much lighter. And for more videos, you can follow my channel.